Hey, there's Dr. Brian McKay, Core Health and Darien. Listen, I know podcasts can be boring as all heck. Hopefully, this is not. If it is, shoot me a email, mckaybdarien at gmail.com, mckaybdarien at gmail.com. Just let me know if these podcasts are starting to suck. It'd be helpful. If you want to make any changes or see any suggestions, I'd love to hear them. But with COVID, everybody's kind of running scared. Not running scared. They're running a lot more. Okay, so that's a key thing. And so the questions that I'm going to go over today that I'm getting is knee pain normal after running? Yeah, especially if you haven't run in a long time, if you haven't stretched properly, if you're not in shape, and all of a sudden you start running, those ligaments need a little bit of time to acclimate. If you're overweight, yeah, the knee's going to hurt after running. If you've had trauma, yeah, your knee's going to hurt. So it's kind of knee pain is normal after running. Unfortunately, very few bodies are really designed to run the distances that we'll try to take on. So it's something to consider. Me from a evolutionary standpoint. If you believe in evolution, not everybody's really fit to run. Shorter distances at higher speeds would probably be a more advantageous thing for someone who's experiencing chronic knee pain after normal. So will knee pain from running go away? Yeah, the knee pain can go away as long as you stop running. But that's where cycling is definitely a lot less harsh on your knee. Um, so something to consider as an alternative. These Pelotons are banging them out, and everybody's loving the Peloton, which is phenomenal because the fact of the matter is, it's just important that you do the exercise. I mean, that's crucial that you're doing some form of exercise. So knee pain can go from running, can go away, but like, all right, next question is how to prevent or how to avoid or stop, reduce knee pain. Well, you kind of have to make sure you're in good shape. First of all, stretching is of utmost importance. Another thing too is, I think we all have the tendency to hold on to shoes too long. What I'm going to suggest is slide your hand after it dries out. If you're going for runs on a regular basis, let the inside of the shoe dry out. Slide your hand and just see if it's smooth, because you might pick up, little changes, subtle changes in the sole, the protective sole in the bottom of your shoe that you're not going to feel with your foot, but you might pick up with your hands. It's a little different sensation. I mean, the balancing nerves. Granted, your feet and hands are very, very sensitive to relay information to the brain, but you have to think about you could feel something's off. Then what you want to do is you want to turn the shoes around and make sure there's an even wear pattern. I mean, if you see something wearing out, it's time to probably change your shoes. And yes, everybody wants to believe me. Everybody, myself included, wants to save money, but sometimes you really have to spend up on a pair of shoes that you get good advice on how to properly fit them, and it could save you a lot of knee pain in the long run. Because I don't know, I'm no spring chicken, and anytime my knees hurt, the first thing I'm thinking about is, okay, do I need to have am I a candidate for knee replacement? And that kind of sucks because no one wants to have knee replacement surgery, not that I'm aware of. So it's really a you know some that you can hopefully avoid, but the fact of the matter is, if your knees hurt, you should really act to do something to minimize that hurt, and that's where stretching comes in. Now, there are dietary things that you can be doing to help protect yourself. If you do not get enough fish oil, and I'm not going to promote any one fish oil over the other, but fish oils, you need to lubricate, and if you're not lubricating the joints, you're just setting yourself up way, way, way too much for issues. Way, way, way. It's just as you get older, you don't produce enough synovial fluid. You produce less, more wear and tear in the legs, being overweight. All these things contribute to knee pain when running. I mean, but it also too is, let's face it, skinny people get knee pain as well. So it's not just a fat person like myself, uh, you know, problem. But it's one of those things. It's just you may have to run. My one advice would be, okay, you can ice afterwards. You can brace while you run. The Cho Pad is a wonderful, wonderful brace. My favorite brace by far. CHO-PAT. They sell them online. You can also pick them up pretty much at Walgreens or CVS, Rite Aid. Those stores pretty much have it, but just look online. CHO hyphen or dash PAT. It's short for chondromalacia patella, but it really is a fantastic, very easy to clean, not too bulky, and you hardly notice you even have it on. But I swear by that one. But you know what? Find a brace you like and have at it, because the idea is to keep exercising, not to stop exercising. But if the knee pain is really getting worse, it would probably behoove you just to consider cutting back on the distance and going for more high speed. These days they call it high intensity workouts, and these things do work. I mean, you're efficient. It's kind of like, think of yourself as a racehorse. That racehorse is out there. You know, he's not going miles and miles. He's going fast, short distance, and sometimes it's a better and also from a metabolic standpoint, the high intensity workout supposedly have a better caloric burn the next few days. If you're a skinny runner, you don't really care. If you're a fat runner, it may just make that a little bit of a difference. Keep you running and less mileage and wear and tear on your on those knees. So, all right, how to treat a knee pain? Yeah, okay. Here's your blanket thing: physical therapy. You know what? Cycling is really good. It's so easy on the knee. Um, it's really but now also too is listen. I do these podcasts to educate my patients and knee pain. Whatever we have a program called the Knee on Track Solution, and it's a really good program for knees. And here's what it is. There's a thing called horizontal therapy that helps fire up the nerves. Okay, so stimulate the nerves that go to the knee. Because listen, nerves transmit pain, but they also can be damaged. So that's part of the knee on track machine. Another thing is the knee on track, where it's a traction device that helps stimulate production of synovial fluid. So synovial fluid is that lubricant inside the joint that is not something easy to produce as you get older. So when you're young, you're not having knee pain. When you start getting a little bit older, yes, you're having knee pain. So those are certain things that we got to consider as far as. But then there are certain stretches and certain exercises that are really really effective and kind of off the grid more so. It's not something you're going to see typically. And that comprises the knee on track solution that we offer here at Core Health in Darien. It's been working pretty well. We're only starting to see the uptick in knee cases because COVID's brought a lot of people out and running. I mean, you need to exercise. The gyms are closed. Well, go for a run, and I applaud you for that. I definitely do. Question is, so that's how I would fix a knee. If the knee doesn't respond, go see an orthopedic. But I mean, I think the knee on track solution is a really good one. I mean, much more comprehensive than just doing physical therapy by itself. I mean, way light years ahead. And it's not cheap, so I mean, it's going to preclude some people from using it. But it's a fantastic treatment. It only takes about a month and a half, 2 months tops, to get the knees back working without pain. Let's go on. Next question. What causes knee pain? Well, wear and tear, overweight, so you can lose weight to help your knees, improper stretching, poor shoes, poor gait disturbance, traumas, previous surgeries or fractures can easily contribute to knee pain. And what other causes? Well, the meniscus wears away. That's the disc between the two. You can have tears in the ligaments. The medial and lateral collateral ligaments don't really go side to side. The anterior cruciate and the posterior cruciate ligaments. The anterior is the bigger one. Posterior, you could probably have a tear in there and maybe not need surgery. But if you have a tear in the anterior cruciate, this kind of creates like a cross pattern inside the knee, and that could be quite requiring to have surgery to resolve it. So it's one of those things to consider. So let's see. What are the questions? How to prevent knee pain running? Lose weight? Don't run? Cycle more? What causes knee pain after running? Well, that's you're going to cause inflammation. And if you already have like a disc, say the meniscus is irritated, you run, you can irritate it. You have to rest, elevate, ice it, maybe a little bit of Advil or Aleve. But also too is some things that people don't really consider is, and I'm glad this question came up. A lot of times like the femur which is the top part of your thigh, the femur is not tracking properly. And at that end motion, when it locks into the knee joint, you can really have some serious issues there. So the femur, I find typically as a chiropractor, my standpoint is looking for is it out of the socket, just in general, or is it internally rotated or externally rotated within the socket? If that's the case, we fix it. Very simple, and that will help mechanically to make sure you're mechanically balanced out there. Now the tibia can go out as well. The fibula not so much, but it does go out. The fibula is that tiny bone in the lower part of your leg that don't know why it's there, but it's really helpful. It's kind of like the ulna to the radius in your arms, your forearms. It does serve a very big purpose in mobility, but it's just there for most people. It's not something you really fracture that often, but it can figure in with knee pain, and as well as poor mechanics of the arch of your foot. So that's something else that can really, So maybe the other thing too is I did forget to mention is sometimes you need an orthotic, um, stabilizing your feet so that when you do run, your mechanics aren't altered seriously. So it's interesting. So it's I think let's go to a couple of the questions. You need pain when running only. Stop running. Well, that's the easiest thing. Um, the fish oil is really big. It's not going to solve it, but it should take out 20% of the sting because it's an essential fatty acid. Essential means you need it but cannot produce it. So in that case, you really would benefit from having a good fish oil, and they're not that terrible. I don't care what people say. Knee pain when running long distance. Yeah, maybe run shorter distance and higher speeds. You're still going to get the exercise and the heart's going to open up. Something to consider. Knee pain when running, not walking. All right, that sounds like osteoarthritis in the knee. That sounds like old age and chronic immobility. Listen, a lot of people don't exercise. Why? I don't know. It's just it's interesting. Knee pain when running but not walking. There's more trauma. There's more impact on your knee. That's why you're gonna have more pain when running, but not walking. You know, Knee pain when running and jumping. Again, you have more impact, and that meniscus is going to shrink up a little bit. And it could tear, and sometimes it flaps over. When it flaps over, so you could be having no pain to having tremendous pain to no pain. It can really vary. Some time and time again. Knee pain when running and squatting. That's a really, really good question. Well, let me explain this. Knee pain when running and squats, with a Smith rack at the gym are really good exercise to strengthen your knee. And what happens is it's not the heavy duty weight. You don't have to go into really pounding the weight, but you got to go in and get deep into it. What it does is it gets that synovial fluid to go throughout your the entire knee. So it's really, really it's really good. So don't worry about the weight. Just worry about getting it deep into the squat and coming up. And you can even do it without weights. But I'm telling you, that's a good one. That's actually my physical therapist here, Ruben Carney, turned me out to the squats. And again, less. You don't have to do a lot of it. Don't kill yourself with the weight. I don't want you screwing your back up. But form is really important. Deep, deep, deep. Get into that squat, and you'd be very appreciative. Now, another thing you can do is just go sit on the bottom, say at your house. So say you don't have a gym and you have a knee pain. This is another good one. I'm on a good bend here, so go with me. Sit on like the second or third stair from the bottom, and then go to standing position, and keep doing that. Now try doing it for 2 minutes, then try doing it for 3 minutes. You're going to work those legs pretty good. Now the next thing is when you get up to like 3 minutes, and try to do it as quick as you possibly can. When you get to 3 minutes, go to the next lower step. Okay, if you start on the third, go to the second, and now kick it in, and you'll see a really good workout. As a matter of fact, I think I'm going to do that workout today. It's 7th of July, and I have my gym is open now with COVID. I can go and use the gym, which is really good, but it's cooled off a little bit here. And what you hear is a machine in the background. I'm doing a little bit of treatment on my elbow right now as we speak. So, so sit on the steps and go to standing position. And if you really might get creative, you have a weight, put a weight in each hand and do it. So it's really not. It's a pretty good thing to try and do, and you can see at home. because and then if you're elderly, sit in a chair. You don't do anything. And I would say if you're elderly, take your shoes off because you want to really stimulate the nerves at the bottom of your feet. And what you can do is you put the you put you just get a chair with a good armrest, really solid chair, not a kitchen chair. I want armrest. And if you have to in the beginning use your arms, just do it 15, 20 times. Well, try not to use your arms. Then when you get to that point where you feel confident, you stop using your arms and then increase the reps. And again, then after a while, when you start feeling comfortable, because you really can start to get one, you get the synovial fluid. Two, you're working the muscles in conjunction. You're actually working the core as well. So it's a really, really helpful thing to do when if you want to keep knee pain away. And this is really good for seniors. I mean, it's good for anybody, but personally, when I do my sitting to standing, I have a 45-pound weight vest that I throw on, and kicks my butt a little bit. But you know, that's what I got to do. And let's keep this moving. That was my signal. Shut up. Knee pain when running slow. That's maybe it's time for an X-ray or an orthopedic consult. That's something else too you got to consider. What causes knee pain running? Well, we talked about weights, overweight. We talked about the running shoes, improper gait, trauma, previous fractures. So that's all. Let's go. Keep moving on here. Why knee pain after running? Because the knees are not meant to run. Our knees are meant to stand. Running as much as we do, if you're heavy or improper biomechanics, that's why you're going to have pain. Or you have a tear in there, you have a trauma. So all these things add up. I mean, chronic knee pain, you should go get it checked out. And I always tell people, get the MRI and bring it with you to the orthopedic. Don't. In the orthopedic, if you need knee surgery, you're not coming to me as a chiropractor for the knee on track solution because, quite honestly, I wouldn't take you. I would take people. We do have people coming to the program who've had knee replacements and still have knee issues, and those people have to wait a year after the knee replacement to get the care. All right, so will pain go away from running? Well, it depends if you do the knee on track solution. No, I'm only kidding. Just take a common sense approach. Something hurts. Obviously, something's causing the pain. You can minimize the pain with medications, but over the long term, you're probably doing more damage. So to that end, I am out of questions on knee pain and running. Hopefully, I answered. Hopefully, you're out there enjoying the summer of COVID. I just got word that the baseball season's starting up, which I really love to go to baseball games. I am Dr. Brian McKay at Core Health in Darien. You can reach us 203-656-3636, 203-656-3636. More than happy to answer any questions you have. If we can't help you, no problem getting you somebody who can. Thanks for listening, and if you find something that you think I should be talking about, hey, drop me a line. McKay, McKay, B as in Brian, Darien@gmail.com. McKay, B, Darien@gmail.com. All right, listen, have a great day. Bye.